Artificial Intelligence Dr. www.abcpharma.net/English. User question: what are the long-term effects of pneumonia on lung function and overall health? And how can we optimize post-pneumonia care to minimize these sequelae? GPT-4o answer: the long-term effects of pneumonia on lung function and overall health can be significant, particularly in vulnerable populations such as the elderly, those with chronic respiratory conditions, and immunocompromised individuals. Optimizing post-pneumonia care is crucial to minimize these sequelae and promote recovery. Here's an overview of the long-term effects and strategies for optimizing post-pneumonia care. Long-term effects of pneumonia. Reduced lung function. 1. Scarring and fibrosis. Severe pneumonia can cause scarring and fibrosis in the lungs, leading to reduced lung elasticity and impaired gas exchange. 2. Chronic obstructive pulmonary disease, COPD. In some cases, pneumonia can exacerbate or contribute to the development of COPD, particularly in smokers and those with pre-existing respiratory conditions. Persistent respiratory symptoms. 1. Chronic cough. Some individuals may experience a persistent cough long after the acute infection has resolved. 2. Dyspnea. Shortness of breath or difficulty breathing can persist, especially during physical exertion. Increased risk of future infections. 1. Weakened immune system. Pneumonia can weaken the immune system, making individuals more susceptible to future respiratory infections. Cardiovascular effects. 1. Increased risk of cardiovascular events. Studies have shown that pneumonia can increase the risk of heart attacks, strokes, and other cardiovascular events, possibly due to systemic inflammation and stress on the cardiovascular system. Functional decline and quality of life. 1. Physical deconditioning. Prolonged illness and hospitalization can lead to muscle weakness and reduced physical fitness. 2. Cognitive impairment. Older adults may experience cognitive decline post-pneumonia, affecting their overall quality of life. Optimizing post-pneumonia care. Pulmonary rehabilitation. 1. Breathing exercises. Encourage exercises that improve lung capacity and function. 2. Physical activity. Gradual, supervised physical activity can help rebuild strength and improve respiratory function. Regular monitoring and follow-up. 1. Lung function tests. Conduct regular spirometry and other pulmonary function tests to monitor recovery and detect any long-term impairments. 2. Chest imaging. Follow-up chest X-rays or CT scans can help assess lung healing and detect any residual damage or complications. Vaccinations. 1. Pneumococcal vaccine. Ensure patients receive pneumococcal vaccines to prevent future infections. 2. Influenza vaccine. Annual flu vaccinations can help reduce the risk of secondary bacterial pneumonia following viral infections. Nutritional support. 1. Balanced diet. A nutrient-rich diet can support overall health and immune function during recovery. 2. Supplements. Consider vitamin and mineral supplements, particularly if the patient has deficiencies that could impair recovery. Medication management. 1. Anti-inflammatory agents. In some cases, anti-inflammatory medications may be prescribed to reduce lung inflammation and promote healing. 2. Bronchodilators and steroids. These medications can help manage persistent respiratory symptoms such as wheezing and shortness of breath. Patient education and self-management. 1. Symptom awareness. Educate patients about the signs and symptoms of recurrent or worsening respiratory issues. 2. Smoking cessation. Encourage and support smoking cessation to improve lung health and reduce the risk of future infections. Mental health support. 1. Cognitive and psychological assessment. Regularly assess for cognitive impairment and psychological distress, providing appropriate interventions and support as needed. Summary. The long-term effects of pneumonia can include reduced lung function, persistent respiratory symptoms, increased risk of future infections, cardiovascular issues, and overall decline in physical and cognitive function. Optimizing post-pneumonia care involves a multifaceted approach, including pulmonary rehabilitation, regular monitoring, vaccinations, nutritional support, medication management, patient education, and mental health support. These strategies can help minimize the sequelae of pneumonia and promote a full and healthy recovery.